So what constitutes an emergency for your insurance company? Welcome. I am the medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. There are three main occurrences I can see. So let's see what they are and how each affects your wallet. But first, a disclaimer. This video is for informative purposes only. It does not seek to offer any medical advice. Only you and medical professionals are best able and suited to determine when, whether, how, and where you should receive care, especially in emergency conditions. So let's explore the meaning of emergency by decreasing level of severity. The first, life or limb at risk. This is the most acute and severe conditions. This is when you would call 911 to get a transport to an emergency room or trauma center. These services are just about always covered at the highest rate by your insurance company. I am talking heart attacks, trauma, serious injury, stroke, broken bones, overdose, seizures, intractable pain, pregnancy issues. An MD or specialist must intervene, and oftentimes special equipment in a facility such as a hospital or ER department is required. When the highest level of care is used to address the severity or urgency of your medical need, it will be coded as emergency. The diagnosis, place of service, and level of medical care will also be indicated on the claim so that your insurance is aware of the specific conditions. Second is when we are talking an emergency not acute or life-threatening, but still serious enough that someone prudent would seek care promptly to avoid potential harm to their health. You usually will not call 911, nor would you necessarily need an ambulance ride. However, it is still a kind of emergency if some unusual or worsening symptoms prompt you to seek medical care by, again, an MD. Whether specific equipment or a hospital emergency are required may depend on the condition itself. Services such as those are often rendered at local urgent care clinics. Allergic reactions, wounds, mild asthma attack, a minor injury, fever, intense pain, etc. The third type of emergency is benign, non-acute, non-severe, but still require some form of medical attention to address, treat, diagnose something that may not feel urgent or life-threatening, but concerning enough that you would not leave it untreated. These kinds of services usually do not require an MD or special equipment, and they can be rendered at urgent care clinics, minute clinics, through teledoc, in your PCP's office, or by your regular doctor. I am speaking of low-grade pain, minor side effects, digestive issues, sprains, STD, minor infections such as eye or ear, and common childhood illnesses. Now, what do these three types of emergency mean for your wallet? The first one is always paid at the highest rate, regardless of whether the provider, hospital, and others are in or out of network. These claims are often subject to special state laws and also all fall under the federal no balance bill law. An added point of advantage, no authorization is needed. The second type of emergency, not as life-threatening but still serious enough, should also be accepted as emergency if the severity of the occurrence and urgency are justified. The facility and any medical providers would code their services as emergency, ensuring the payment at the highest rate, regardless of whether they are in or out of network. And yes, these claims would again fall under any special state or federal no balance bill law. No authorization would be needed as well. The reason number 3 may not always be accepted as an emergency. This is where most problems occur. The severity and the need for urgency must be compatible with a place of service and the license of a professional. What I mean by that is if a nurse practitioner, or physician assistant renders the service, they may not be considered emergency. In such case, the services would be paid based on the tax ID number of that provider, whether they are in or out of network, and the claims would not be subject to balance bill laws. Most denial will say that care could have been handled by your PCP or during business hours or even through the insurance nursing line open 24/7. A good example would be going to a hospital ER for a minor urinary tract infection, pink eye, a sprain, or your child's ear infection. If your insurance deems that the care could have been given at a lower level, you can expect, unfortunately, a denial to be showing up on your list of EOBs. I encourage you to watch other videos on this topic for additional more in-depth information. So thank you for watching. And please, if you find the content on this and other videos helpful, do like, comment, or subscribe. It does help support the channel and help me reach out to more patients like you. Thank you.